bring to you a new edition of T.H.E.M.E.S Agenda This week, a special report that focuses on the activities of the T.H.E.M.E.S Agenda of Lagos State Governor. In a bid to ensure that every citizen and resident of Lagos live comfortably in good health and wealth, Governor Babajide Sanwo-Olu, in pursuance of the 6-point T.H.E.M.E.S Agenda of his administration through the letter H, which stands for Health and Environment, is determined to deliver a good health care system by strengthening the regulatory apparatus positioned to guarantee this. In today's special report on T.H.E.M.E.S Agenda This week, Aderayo Idowu Olaiya of our News and Current Affairs Department analyzes the role of the Lagos State Health Management Agency, LASHMA, in line with the T.H.E.M.E.S Agenda of Governor Babajide Sanwo-Olu. One of the promises of Governor Babajide Sanwo-Olu to Lagosians at inception of his administration is to ensure and provide effective, accessible, affordable and adequate healthcare delivery system to the teeming residents of the state. LASHMA is a health regulatory body created to provide a social security system that guarantees needed health services to people paying annual premium contributions through the Lagos State Health Insurance Scheme. It is primarily a risk-sharing arrangement that can improve resource mobilization and equity in the healthcare sector. Going by the World Health Organization, Universal Health Coverage targets that people have access to needed health services, including prevention, promotion, treatment, rehabilitation, and sufficient quality, while also ensuring that the use of these services does not expose the user to financial hardship. The present administration of Governor Babajide Sanwo-Olu again has taken a giant stride in ensuring that Lagos attains this height through the Lagos State Health Scheme, LSHS. The Lagos State Health Scheme captures a public health insurance initiative for citizens of all ages within the 20 local government areas of the state, accommodating the local council development areas as well. Showing the political will, Governor Sanwo-Olu approved the commencement of the Lagos State Health Scheme, LSHS, for its employees with effect from 1st June 2020, with payments of 75% of the annual family insurance premium each public servant. With the takeoff of the scheme, public servants have access to medical care in any of their chosen facilities among over 200 hospitals under the Lagos State Health Scheme spread across the state, with plans by the government to add more as time goes by. The scheme, with an individual payment of 8,500 naira, also has a family package of 40,000 naira covering the father, mother, and 4 children. After payment of the premium, the enrollees enjoy benefits which include enrollment and consultation, treatment of common ailments such as malaria, hypertension, diabetes, family planning services, dental care, ultrasound scan, radiological investigations, and child welfare services, care of childhood illnesses, neonatal services, gynecological prenatal care, and delivery. Lagos State Health Management Agency, LASHMA, the regulatory body of the scheme, is not resting on its laurels to ensure a massive sensitization campaign that will bring every resident abreast of the nitty-gritty of the scheme. This is to ensure that every resident of the state taps into the scheme for improved and well-monitored healthcare delivery system, as validated by the General Manager of LASHMA, Emmanuela Zamba.
We're also responsible in a large way to ensuring that people do not get financially impoverished in accessing this healthcare. So care must be readily available, it must be affordable, it must be the same type of care for whether you are a market woman or a corporate executive. You're even somebody that cannot even pay for yourself. We are supposed to be the leveler. The principles we are operating on are equity as well as solidarity. As at September, we are moving towards $250,000 right now. Services are provided by both public and private providers. We have a network of about 205 facilities, 129 or 130 private facilities, and the rest of that are a mix of primary healthcare centers and secondary healthcare centers under the public sector. So that comes to about 73.
To further validate and show commitment of the government beyond paying lip service, the Lagos State government, through the Lagos State Health Management Agency, LASHMA, in June, welcomed its first public servant baby under the Lagos State Health Scheme. Speaking at the baby's debut, the general manager of the agency described the event as double celebrations since the birth of the baby coincided with Public Service Day anniversary.
I mean, even the baby was even born on public service day. So we actually went to visit. They delivered at a private facility. That was their choice. That's the hospital that they've signed themselves up to. A little baby girl, and we went to visit. It was a very, I think, emotional moment. Even the head of service, we had to call him.
Taking a giant stride further, this December, Governor Sanwo-Olu approved the release of funds from the equity of the Lagos State Health Scheme, LASHMA, to provide free health care for 50,000 orphans, the elderly and the vulnerable in the state. This decision coincided with the celebration of the year 2020 Universal Healthcare Coverage UHC Day, organized by the Lagos State Health Management Agency, LASHMA. The development was in furtherance of the commitment of the government to expand access to healthcare delivery, especially for the less privileged. The day is celebrated annually as the rallying point for the growing global movement for health for all, and was observed in Lagos State in line with the agenda of the state government to ensure access to quality healthcare services for all residents, irrespective of their age or social status. The Sanwo-Olu's administration considers the Lagos State Health Scheme to be very important to the people, as it places a very high premium on the well-being of all the residents in the state. The state government encourages corporate organizations and companies in the state to enroll their workers on the Lagos State Health Scheme towards enhancing their job performance, productivity, and improved profitability for their businesses. This is because the informal sector constitutes a large percentage of employers of labor and is therefore important in the economy of the state and the country at large. Faced with the challenge posed by the COVID-19 pandemic, Lagos launched a virtual medical consultation service, T.H.E.M.E for residents, as part of efforts to protect citizens and reduce their risk of contracting COVID-19. T.H.E.M.E was designed by the Lagos State Health Management Agency, LASHMA, to increase access to care, reduce the challenge of going to hospitals during the pandemic. Through the project, residents are able to have access to highly trained and experienced physicians for non-emergency primary care consultation through voice or video. The general manager further speaks on this.
It is a child born out of the COVID-19. There was the lockdown, and some people will still need care even during that period. It is not only COVID-19 that was and is an issue for us. I mean, we have maternal mortality, child mortality. You know, our indices, they're not fantastic. So we needed to find a way to allow people to still have access to care during that lockdown, so that we reduce their risk of exposure for COVID-19, both to the patients and also to even the health workers in the facilities. So that's why we came up with the T.H.E.M.E, and Governor graciously approved that it should be provided free of charge to residents in Lagos State for, I think, about 2 months when we first started. In May till July, it was free. You call in anywhere you are and they would attend to you. You are entitled to the service as an enrollee.
Health insurance, though, that protects one from the financial burden of an unexpected medical bill. Some LSHS subscribers share their experiences when assessing care under the scheme.
Well, so far, their services have been so good. Would have been there like 3 times now, and their service is excellent. I must commend them.
I started using it 2 months ago or 3 months ago. Then the service is okay. Hospital that I took, they attend to me very well. My children were given opportunity for the test, both drugs, then the other necessary things under the program.
I've been registered.
Well, I would say that, the scheme has been very, very good because, anytime that I feel ill a little bit, I will just go to the hospital to treat myself. I'll give kudos to the present administration because they've been doing quite all right in terms of health.
The LSHS is working for me. Yes, it's very good. I've been using it for the past 14 months now. It is worth.
Also, some Lagos residents expressed their opinion about the scheme.
But generally, I think it is also working for some people. To be fair, some of my friends who are also on the scheme have also said beautiful things about it, and they've given very good reviews as regards the LSHS.
No, I've heard about it, but not much.
They have to, what they could have done, they have to take it to the grassroots level, in the sense that they will go from house to house to campaign.
But it's very, very important. It's good.
So how we advise people to go into it.
health is germane to national development. With plans to achieve universal health coverage and promise to work assiduously towards achieving the goal of making healthcare accessible for all residents by 2025, there is a clear signal that the Lagos State government is poised to effectively carry out the mandate given under the second pillar of the T.H.E.M.E.S Agenda, accommodating health and environment. The Lagos State Health Scheme LASHMA is a child of necessity born to bridge the gap of deficit in the health sector, which Lagos residents are advised to tap into to achieve a universal health program for all. This is where we conclude this week's edition of the special report on the activities and achievements of the T.H.E.M.E.S Agenda, which analyzed the role of the Lagos State Health Management Agency, LASHMA, in line with the T.H.E.M.E.S Agenda of Governor Babajide Sanwo-Olu. For feedback, you can follow us on all our social media platforms: Twitter at Lagos Traffic 961, Instagram Lagos Traffic, Facebook Lagos Traffic Radio 96.1 FM. On YouTube, subscribe to our channel Traffic Radio 961. This program is a production of Lagos Traffic Radio 96.1 FM. I am Abiola Fagbolago.